Hi, either one. Either one. 10:43. I picked up a small baggie with some residual white substance in it. Collected it. You show me today. Okay.
Lee Turbin,
Here.
Darren Hoggett,
Here.
Dr. Clooney. Here. Patrick Hutchinson,
He indicated he would likely not have it.
Matt Shady,
Is there sound on?
Online.
Echo.
Jerry Harder is not going to be here. He is in Alaska. John Starman,
Here.
Dr. Sarah Brown said she also will not be here. Matt McCullough,
Here.
Andrew Bowman.
He's an African.
I knew he said he might be online, so I want to double check.
He texted and he apologized he will not be available.
Okay, perfect. Mary Ann Dudley. Here. Dr. Nossett.
Also on vacation in Florida.
Perfect. Lori Maley. Here. And Jonathan Witham.
Here.
Okay, we have four.
That is Florida. Or the track. I don't know.
All right, we do have a forum, if I could please stand for the pledge of allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, moving ahead, introduction and welcome.
Thank you. Welcome everyone for being here in May. For the record, I do not require my staff to dress like me. They just will to do today. Nice May Day, and we got a lot of conflicting events, so appreciate everyone, both commission wise and the public. And we also will have, as you'll see, we have in person from Indiana Department of Health. We have Vince will be here in person this time.
Moving on to adoption of minutes, pleasure of the commission. Motion to approve. Second. Approved and second. Any discussion? All in favor of approval? Aye. We have one person online, correct? But we do have to do a roll call for that.
Lee Turbin,
Yes.
Darren Hoggett,
Aye.
Dr. Clooney. Aye. Matt Shady,
Aye.
John Starman,
Aye.
Matt McCullough,
Aye.
Mary Ann Dudley. Aye. Lori Maley.
Aye.
And Jonathan Witham.
Aye.
Motion passes.
Minutes for March 2024 have been approved. Honorary certificates.
So for honorary recognitions, we have them down there. We did have one State EMS Directors Award for Priscilla Broderick. The rest of them, we did do a few of those in person, several cardiac arrests. And we did do a recognition yesterday that I wanted to share. I think he has communicated with us over the years. Dave Hosick is our public affairs director, and he joined the office, I believe, around 2019. The book was after me, but he has been there many years. And really, as we ramped up COVID, as you know, we increased our communications and really he has helped advance the cause as much as anyone. And even when, for instance, with some of the investigations that made the news, he really wants to understand EMS and has gained a great working knowledge. So with Lee's consultation, we did issue him honorary EMT certification, presented that yesterday to him in the office, and he was proudly sharing it with everyone. So we thank Dave Hosick for his service. You may hear from him. He is transferring to the Indianapolis Zoo. So we wish him the best there.
It's not showing up on it, Craig. Your slide deck is not showing up on the online.
It might just be your computer, it's
Okay.
on mine.
All right, as long as everybody else see it, I can't see it. Okay.
Moving on, Indiana Department of Health.
All right. So good morning, everyone. It's nice to be here in person instead of running through on the phone. And I know it's a little bit early, but I don't know if I'll have the ear of this group. So I just want to say happy EMS week coming up here in a couple of weeks. So I figured that I'll get that out now. And see if I can. Oh, okay. So I'd like to start all off our IDH presentations, kind of going over our mission and our vision. I think it applies to everyone in this room in particular. The main goal is to make sure we promote, protect, and improve the health and safety of all Hoosiers. And that doesn't really matter where you're at. It's just, I think, good karma to do so. Thing was faster than me. So I want to talk a little bit about, we had our Trauma Care Commission meeting last Friday. Some of you may have been online or in person there. Really good meeting. Not that they have not been good meetings, but we got a lot of good stuff accomplished. One of the things I want to talk about is trauma system designation. We continue to work on filling some of that, we say white space. If you've seen that map that shows greater than 45 minutes to get to a trauma center. So we'll continue to work with some facilities that are interested to help fill that and bridge that gap and close that time that it takes for to get from a site to a trauma center. So that's good news. Hopefully I'll have some more input on that in future meetings to be able to share with everyone. Trauma Regional Advisory Council. So you'll hear them called TRACs. Again, some of the folks on this call may be on some of our TRAC meetings. We have 3. I think I've spoken about this in the past, but to briefly review, we have a North, which is your disaster preparedness districts 1, 2, and 3. Central, which is 4, 5, 6, and 7. And then your Southern, which is 8, 9, and 10. So with that, we broke them down. We have a regional clinical coordinator that comes out of my office that helps support each region. And part of what we did, looking is at funding for each of these tracks now. So what this does is it allows the track level to help put money where it's needed for their region. So instead of it coming out of our office, and not just our office, we work with the Trauma Care Commission, obviously, and other stakeholders, but now it can be more focused into the region where it's needed. So we can help those gaps in education, could be training, could be whatever might be needed that's recognized within those regions. So really exciting information coming out of that. And just to kind of show you what we're looking at here, these are the numbers for the first iteration. So for the North, Central, and South, basically, these are going to get shifted a little bit. This was based on some preliminary numbers before the legislation went through and approved funding. But year 1, we're going to take basically a third of the trauma dollars that were awarded, give those back to the tracks. Year 2, about half of that. And just to kind of put in, these are not set in stone. So for example, if the North track says, you know, we've spent $500,000 and it's only September, and we have a great project that we want to invest in, they're able to come back to the Trauma Care Commission and we're able to allot some other funding because again, 2/3 of it is kept still for like state projects and bigger projects outside of just the region. So first time this has happened, so it's very exciting. All the regions are excited. My regional clinical coordinators are excited. I'm excited. You guys are excited. But it is an opportunity at those regional levels. And included in those, again, if you're not familiar, it's not just the hospitals. We have our HCCs, we have representatives from EMS. So by all means, if this is new and you've not heard of it, feel free to reach out. I'll have some contact information for your regional clinical coordinator and myself, because that's how we're going to grow this. And that's how we want it to be the most effective for all the Hoosiers in those areas and for the folks taking care of them.
You spoke too soon.
See, we can get happy with it quicker. So we talked a little bit about there's going to be some funding for trails. So part of that is going to be creating some buckets, and we have some loose guidelines already put together. Again, loosely, but there could be training, simulation, whatever, that kind of gets in that equipment, technology, community outreach. All these are going to fall under at a regional level, and we're building that up right now to make sure that we kind of have some pre-approved activities to keep things moving a little quicker, so that every time a region says, we'd like to, you know, spend X amount of dollars and train some of these non-critical facilities on TNCC, it's not waiting for a quarterly meeting or, you know, approval. It's going to be kind of, okay, this falls under the scope of something that's already approved, and we just move forward. And really just trying to keep the momentum and keep getting the education, keep getting the needs out there fulfilled and not getting stalled by some of the process. We'll put together a funding template, so each track will be responsible to kind of say, here's our outline, if you will, sort of a business plan. Again, knowing that this is year one for it, there's some opportunity to kind of manipulate and change it around. And of course, we'll have reporting or feedback structure, so it's not the Wild West where we're just throwing dollars and don't pay any attention to it. So all that's going into place right now. So again, hopefully at a future meeting, I'll be able to share some more on that, but super exciting to be able to get those funds out at a regional level. And, you know, for those of you who were aware, like last year was really the first year we got funding for trauma. So to be able to go now and be this far in such a short period of time is pretty exciting. So moving on, just for your awareness too, we visited some of the sites, the trauma centers across the state that are doing re-verifications. So they're listed here, and there may be some that get added to it between now and the rest of the year, but these are the folks that are coming up, and this is not an easy task for them either. The requirements, as you imagine, constantly change, and it's a pretty lengthy process to get the information submitted now. So this last year, they made some significant changes at the ACS level. So we continue to support these folks as best we can from my office, and just something that, you know, if any of your teams are out there and you see these names coming up and people are running around a little bit, and maybe not see the trauma program managers as much. It may be, if they're getting close, it may be that they're having re-verification and they're just running around. A lot going on.
Takes it about 5 seconds. When you click it, it shows up here.
Oh, so did I just go too far? So I'm afraid I'm gonna overclick here. So the next thing we'll talk about, and I don't know if you're seeing it, but it's trauma awareness month.
Yeah, you just went to,
Did it go?
yeah, you go back, there you go.
All right.
I just did it manually.
Oh, thank you, because technology, so maybe part of this funding will go to teach me how to use this. So May is also National Trauma Awareness Month, and part of what our trauma outreach and our trauma education outreach subcommittee worked on was getting a toolkit together, primarily going to be shared through social media platforms. We do have some information on our at our website where people want to see. There was a conversation with the commissioner. Basically, Dr. Lindsay Weaver spoke with Dr. Eric Strive out of Eskenazi and Dr. Matt Landman, who's out of Riley, both trauma surgeons at trauma verified centers, and just kind of talked about the importance of trauma awareness within the public, and just giving some basic facts that many folks here probably are aware of, but just to kind of make the group aware of what's going on out there and some of the work we're put around it. The next slide we get there is just really kind of showing the things that are going out through social media, Facebook, Instagram. I will be less versed in those things myself, so. This is a great one. I like to reiterate this. The Rural Health Innovation Collaborative has gotten a grant through our division to do some rural trauma simulation events. Matter of fact, there's one happening right now in Decatur County at Adams. I think that's Decatur County, I might have that wrong, but it's at Adams Memorial. So kind of our northeast region. Alan, is it Alan? So these events are for everyone in the trauma space, EMS, nurses, respiratory therapy, physicians. So we do always have a challenge trying to get some of the docs to show up because as you can imagine, some of these facilities are staffed by one physician if it's a small enough facility. So depending what's going on. But I wanted to put this list out and let folks know this is also on our website under our trauma system development tab, or trauma systems plan. There's a educational opportunity and it's free. So if I said it, let me say it again. It is free. They've got state-of-the-art mannequins that moan and cry and bleed, do all kinds of stuff. They use moulage. I've been to a few of them. It's actually pretty well put together. We've had a great response. You can see got some respiratory therapists, different EMTs. So again, please share this. If anyone has any questions where you can get this information, don't hesitate to reach out to me. We really want to support these education initiatives, especially in the rural space. So that the hospitals and the providers there are as well versed as we can get them. Change on your end yet? There it is. Probably great company. Save the date. So October 1st and 2nd will be our second statewide trauma and emergency medicine symposium. So if any of you attended at Fisher's last year, this is the next one. We just shifted the timeline around a little bit. We knew December can get a little touch and go. You don't know what the weather's going to be. It's a busy time of year. So we moved this to October 1st and 2nd. And this year it's going to be at the Monroe Convention Center in Bloomington, Indiana. The idea there is we want to try to capture some of those folks from more of the southern part of the state that maybe felt like Fisher's was too far north. And so we're trying to be as cognizant as possible, knowing we do one a year, and we're trying to gather as much folks as we can. But more to come on that. There's still some work being done. Primarily, we know that we're going to have a training day on day one, or a conference day on day one with breakouts. So this year it'll be set up a little different. It's a bigger venue because we didn't hit capacity, but we sold out to capacity last year. So if some folks can attend, I apologize. But this year we have a bigger venue and we have breakouts. So maybe a little more tailored to your interests and what you want to participate. We're going to have vendors this year. We're still working on putting those together, but hopefully again, vendors that relate well to the products and things that you may be looking for. Take suggestions. So it's not, like I said, it's not set in stone yet for all of it. So if anyone has somebody who thinks there's a really nice job presenting, or it's really useful to have at a space where a lot of your folks will be, by all means, let myself know and I can get it to Madeline Wilson, who's working with us at IHA. Day two, we'll have some educational work. So right now, from my understanding, these are all locked in. So we have tiny trauma, and that's Scott DeBoer. He did the pediatrics education, which was very, very well received at the last session. So he's coming back with a different twist. Mental first aid following mass casualty done by the MESH group. So this is something we continue to work on. One of my regional clinical coordinators really has taken upon herself. We realize that there's a mental aspect to a trauma event for the patient for sure. What isn't often shared or looked at as often as what that does to the first responders, right? The EMTs, the paramedics, your emergency room physicians, nurses. So we're trying to take another look at that, see where we can make some strides and recognize these folks as well, saying, you're seeing, some of the worst things day after day. What does that do for them, right? And we know we have awareness in that in the military, some of the events that we've gone through. So it's really a similar type of event that happens from a mental standpoint on our first responders as well. So hopefully you'll continue to see more education and more events and outreach and things in that space as we go through. But I can say that we are aware of it, and we are something that it's on our radar to continue to push forward. And then the last thing, probably less interesting to this group, is the trauma registry meeting. So just again, for the folks in the room that may not be as familiar, a lot of the projects we do and a lot of the direction that we take in trauma is based on data we get from our hospitals, from trauma events, both trauma centers and non-trauma centers. So in order for that to be as reliable and to be as robust as possible, we need to get everyone in the state submitting, and not just submitting, but submitting the right cases and the right information. So we've done a ton of work. This is just going to help expand upon that. And I can talk about that if anyone's interested in it more later. Data quality. All right. So data quality reports, this goes right in line with what I was just saying. We're doing a lot of work on the back end. Our data and surveillance team has been just going through like crazy, trying to clean up all the reports, putting things together that are useful for both facilities and for other stakeholders that may be using this data to make decisions, and just cleaning up, making sure we got the best data and the best information we can share. Image trend validity rule. So that is part of what I'm talking about when those facilities, they upload or they manually enter their trauma cases into Image Trend, which is the vendor that we use with IDOH. There's validity rules in there that are able to be manipulated now to match like the trauma database standards if there's specifics that we want at a state level. So we're able to clean those up. So now when a facility is putting that in, they know immediately if they're hitting criteria or they're missing, like we have a couple of tiers, and I don't need to get too deep, but so that there's like kind of critical information that is a must have, and then there's some that is like nice to have. And now this will tell those facilities, hey, you missed this. So before you even submit it, you have an opportunity to correct it. And the reason that's important is because what has happened in the past, that was getting done on the back end with someone from our team going through, kind of scrubbing it and then sending it back out to the facility saying, hey, you did a good job, but you missed a couple things. So now they can do that before they even submit it. So it cuts down a lot of back and forth and a lot of confusion. I just wanted to highlight some of these special emphasis reports. So they're published on our website. The first four you'll notice right there: child injuries, drowning, traumatic brain injury, and older adult falls. These are things that we hope to continue to put on the website if there's other areas of particular interest that you feel should be there or that you have an interest in. Again, don't hesitate to let me know. I can share that with our data team. And these are things that we will continue to update as new information and data comes in. But if you have an opportunity, it's pretty interesting. Our team does a great job of putting together kind of like one pagers, although most of them are a couple pages, but it puts the data down in different ways and really easy to read and get some useful information out of, hopefully. Hospital dashboard, I'll just be real quick on this one. We've been putting it together since before I've been here, but it's in the home stretch right now. Dashboards that hospitals can go in, they'll have a unique code, and it will show them all their data that compared it to the state or the region, but it will be de-identified, and they will only have access to their specific information from a solo standpoint. Regional track reports, these are brand new, and I'll give you an example here on the next slide. These are what we've done for all three of the tracks on this last set of meetings. And but basically, we're able to break it down by district, show that region, how it compares to the region, how their region compares to the state. And then in some of these, we're able to break them down actually by districts and show how they work as well. Performance improvement planning. So a lot of good work going on with our PI subcommittee. I'm trying to keep our chairperson on task to make sure that we continue to move this forward. So we have a statewide performance improvement plan in a draft form now. We're actually going to probably be reviewing that at the next subcommittee meeting next week. And then we have some improvement indicators that the subcommittee has kind of looked through, proposed some ideas, and our data and surveillance team has started tearing into those and saying, okay, here's what we can do. What are you looking for? Maybe we have to tweak this. So that continues to move forward. Really exciting work. I hope I didn't go over time. There's another slide. See, this is my name. These are your contacts. So our regional clinical coordinators, Nicole Raylander is the north, Sonia Hughes is your central, and Kim Berger is your south. They are embedded in those regions. They've been going out, shaking hands and making those connections and building those relationships, which has proved invaluable to kind of get buy-in and get support from the facilities. So I continue to really lean on them. And so if you have anything, feel free to reach out to them if it's in your region and you have questions or concerns or whatnot. And I'm there as well. Ramsey Nimri, who many of you probably know the name because he's like the name in trauma here. And then our data and surveillance team, Lauren Milroy and Alex Marsander, they're doing a lot of that great work you see in those reports that I was speaking of earlier. So with that, I guess any questions for me? All right. Well, thank you all for your time. And if I can be of any help in the future, don't hesitate to reach out. Thank you.
Just a little bit.
Thank you. We wrapped up the legislative year. We started January 8th, finished on April 25th, just after midnight. And this was the long year of the 2-year cycle, so there was a budget year. Again, you can always go to the Indiana General Assembly, IGA website, if you want to read any more on these bills. The ones we were tracking, the state budget, EMS readiness did stay in. It was around 4.1 million for fiscal year for the next 2 years. So that is a positive win to support EMS. MIH grants, unfortunately, as the on House Enrolled Act 1051, the good news was it was expanded. It was added, counties were added to city, towns, and townships as eligible recipients of the commission grant. But they also did add, if there is not sort of I'm simplifying it, but if there wasn't a municipal, a city, town, or township, or a county that applies, then a private service or a hospital can apply for a grant in that area. Unfortunately, back up to the budget, they then nixed the 500,000 a year for the next 2 years. So there is no funding for the grant, even though it's opened up for people.
I was supposed to be
However,
on this meeting and I kind of forgot about it. It's,
we are looking at whether we can use EMS readiness because it can be used to fund MIH. So we are looking at what our alternatives are in order to assist MIH, whether it's to do a similar grant on the readiness side or how we do that. House Enrolled Act 1113 did pass. That's the one that allowed formation of prior protection district. EMS coverage was one of the reasons. Instead of being an individual line item, why they can do a fire protection district, it has to still be in conjunction with fire. So it got modified a little, but it does have reference to EMS in there. House Enrolled Act 1118, critical incident stress management sign takes effect July 1st. That again means if you do CISP or CISM with your crews, whatever communications occur within those sessions are confidential. So you don't have to divulge that later in a malpractice lawsuit or otherwise. And so that's an important protection. House 1297 Motor Vehicle Information Program. That is a national program called Yellow Dot, which we will get to in a minute. But essentially says providers can recognize the Yellow Dot as protection from civil liability in the statute. And so we will definitely be doing some education as we'll get to in a minute. House Enrolled Act 1587 Insurance Matters does allow for state plans to fund MIH services through a state plan, which would be like our health insurance. But sometimes that is what is used to set the example for private insurance as well. So we're hopeful that maybe that will be kind of open the floodgates a little. And that was signed into law and it's effective July 1st. Back to the Yellow Dot program. That one is actually going to be handled by the Division of Aging through FSSA. But they have been partnering and we have online Amber Marr from AARP. And they are going to talk about where they see that kind of going, the basics of how the program works. And so I'll turn it over to Amber to kind of brief on that.
Thank you so much. Good morning, everyone. As Director Kinney said, my name is Amber Marr. I'm with AARP Indiana, and just wanted to give a quick overview of the Motor Vehicle Yellow Dot medical program that we supported and look forward to supporting as we move forward when this takes effect. Just quickly, just a little bit about what this program does and how it works, at least at how it's been working in other states. It is a voluntary program. It was put into action, as Director Kinney also said, by House Enrolled Act 1297. Participants in the program will put a yellow sticker on the rear driver's side window of their vehicles, and then store a yellow envelope with important medical information in their glove compartment. Some of that medical information that will be on a form that will be in the glove compartment includes the participant's name, a photograph of the participant, contact information for more than 2 emergency contacts for that participant, the program participants' medical information, including conditions, recent surgeries, allergies, current medications, hospital preference, and then contact information for more than 2 healthcare providers of where they get their care. And then obviously the date the program they had entered into the program will also be on the form. I think what is still sort of out there is that we, Hannah Carlock, who is the interim CEO of the Indiana Area Agencies on Aging, and myself, along with several legislators, we had really worked hard to try to understand how this would really affect not only Indiana, but also EMS and anyone that would be arriving on the scene of an accident where someone would have this yellow dot on their vehicle. And so we are just waiting for the Family and Social Services Administration to sort of compile these forms and these packets. So I think what we really wanted to say is, while we don't have a full example to show you what it would look like, we hope to have that soon. And I know that all of you do not get back together until after this law takes effect. But Hannah and I wanted to make sure that we shared today that once these packets are available, we really would want to send them and have an example sent out to all of you, or at least through Director Kinney, to disperse it so that you can see what it would look like, kind of what this packet, what an individual would fill out. And where individuals can get this packet is eventually, once FSSA compiles them, the AAAs, or the area agencies on aging across the state, you'll be able to access them there. You can pick up a packet there, or when you are at the BMV, they will be available, and they're free of charge. You do not have to pay for them. Individuals can just pick up the packet and begin participating in the program. Sort of looking forward, one of the things that we had promised Representative Arrington when she brought this bill forward is that, we really want to make sure that as this bill, takes effect, we want to be working with all partners that would be kind of coming up on a vehicle that would have this yellow dot. So including yourselves, sheriffs, and anyone else in the community that might need to know. So our plan is to have sort of some branded flyers here shortly, once we can really see what these forms look like, and make sure that we are traveling to different area agencies on aging to do some of these trainings. We do not have dates yet. Actually, Hannah and I are meeting next week to kind of figure out what this educational sort of roadshow looks like. But we were hoping we could share these dates with Director Kinney, and then also, maybe if anyone in the area would like to join us for these educational trainings, we would welcome any and all. So hopefully folks will be able to attend those depending on the areas that we're in. But this would just be to have the packet, show examples, explain what this means, why people, would want to participate in the program, how the AAAs are supposed to participate, and just sort of things like that. So we would love to continue to partner with all of you. And like we had said, anyone else in these areas that would like to join us, firefighters, the police, et cetera, that would want to be informed of all of this. So we still have a lot of work to do since this just passed, and we are sort of on hold as we wait for these to be compiled. But as always, we're happy to continue to keep you in the loop, answer any questions if we can, but also just make sure that we are remaining in communication and can help along the way. I'm just making sure that I didn't forget anything else. Oh, and just, I think also, Director Kinney may have mentioned this, but the Yellow Dot program is currently active in 22 states right now. So this really is something that is happening across the United States and really becoming a thing to sort of help have individuals maybe receive quicker services, or for you all and first responders to have a better idea of who they're handling or dealing with, especially if someone can't speak or is, unconscious, et cetera. There's a little more information that you can look at or learn about so that you can help them get the best help that they need in the quickest manner. So I think, Dr. Kinney, that might be everything that I wanted to share. Oh, yes, and you had already mentioned that this in the bill, it does give civil liability, immune from civil liability for any individuals that are using this information, just because this is really just as a assistance, and we did not want anything to come out of someone using this information to help somebody. So this is definitely, that was a piece that we wanted to highlight. So I will turn it back to you, Director Kinney, and if there's anything that I forgot, please let me know, or if anyone has any questions, I'm happy to answer them, but we would love to stay in contact and make sure that we share those travel dates with all of you. And so folks within the community could join us and we can kind of help continue to spread the word.
There was a question online. It is effective July 1st, like the rest of the statutes, and then the next commission meeting is July 18th. So when I saw the bill, I'm like, I haven't heard anything about this. I'm like, someone is advancing the bill. And I'm thankful because, when we reached out to Anna and Amber, then, really the bill just passed. So the Division of Aging is still figuring out, presumably we'll have our own sticker or something. But I appreciate them on short notice, answering what we do know. And we will continue to message. We don't have to wait until the next EMS commission meeting. Our office will message out about it. Particularly watch the newsletter. I explained that we would have one coming out in June. And so as we get information, we will definitely share it with everyone. I just think it's a valuable resource for the communities. I will pause for a minute while Amber's still on and myself. Does anyone have any questions on the Yellow Dot program right now?
And yes, I did just want to confirm with you, Director Kinney, that it is July 1st. That is when the bill takes effect. So yes, you're correct.
Okay, moving on to thank you. Moving on to other legislation on the Senate side, we had Senate Enrolled Act 1, property tax relief. That was signed into law. No direct mention of EMS, but as we know, there's a trickle down effect. And so a lot of counties may be looking at their options for funding, and we will continue to monitor that. Senate Enrolled Act 505 is emergency transport to appropriate facility. Just signed yesterday. I was anxiously waiting. I was like, uh-oh, is there a holdup? But it did get signed. This allows transport to a facility other than a hospital. And it can be another type of healthcare facility. It could be an urgent care. One of the amendments, and we again will message on this one, and I know Dr. Yazel talks about it a lot, providers are going to have prior arrangements. So they can't just say, oh, there's a new acute care that popped up. Let's just turn in here and drop off our patient. It doesn't work that way. They're going to need a prior arrangement. But if there are appropriate facilities in your areas, it will be worth considering those to reduce the burden on your hospitals. So I think this is going to be a positive one. Dr. Yazel testified on its behalf. We think it's going to do good things. If I hit the right computer. House Enrolled Act 1515, we did not track this one. This one is education and higher education matters. And with it, it requires all public, charter, and accredited non-public schools to have at least one AED and develop an action plan for sudden cardiac arrest. We did get, that was signed into law. It's also effective July 1st. It actually tasked the Indiana Department of Education, but I wanted to give a heads up that the Department of Education safety specialist reached out, and she's like, hey, is it okay if we list EMS as a resource? And I said, absolutely. So you may get schools in your community that reach out and say that, hey, we're trying to develop a cardiac arrest plan. Can you help us with that? And we hope that you will. If you don't have the resources or can't for some reason, we have made the district managers available as well. And so we're committed, and I'm glad Department of Education thought to reach out to us on this. And it'll improve, hopefully, safety response in the schools by having an AED and a plan. Those are all of the legislative updates that I have for this year. I'm open to any questions.
Any questions for Director Kenny? Seeing hearing none, we'll move on to EMS for Children, Margot Bell.
Good morning, Margot Knuppelkamp, Program Manager for IUMC. You may be aware that the National EMS for Children program is at risk, and there is a tool that individuals can use to show your support for EMS for children. This toolkit contains shareable social media posts, draft letters, and talking points to advocate for continuing funding for the EMS for Children program. Please feel free to share and adapt as needed. The PPRP data that we've been talking about for almost a year now is still on hold. The pre-hospital pediatric readiness project assessment occurred late last spring, summer, with limited conversations with HRSA as they're working through the Trump administration changes. We're still just waiting. We are expecting 2 reports. One will be BLS and one will be ALS. Meanwhile, please review your individual gap reports and utilize the toolkit as you work with your medical director. The American Academy of Pediatrics has developed a simulation disaster day. You can learn through an interactive course to equip EMS leaders with the skills they need to create their own realistic scenarios and run simulations with their EMS crews. This training will occur on June 16th in the Chicago area. This interactive course equips EMS educators with the skills needed to design, implement, and facilitate high-impact simulation scenarios. Participants will gain hands-on experience developing realistic scenarios and apply this knowledge by setting up and running simulations with live EMS crews. Please complete the application by Friday, May 16th. You have 1 more week to do so. Space is limited, and then applicants will be notified on May 26th. And lastly, part of National EMS Week, which begins March 19th to the 24th. EMS for Children Day is on Wednesday, May 21st. This is an annual opportunity to thank EMS clinicians for their dedication to meeting children's unique health needs and to spotlight the work of the federal EMS for Children program. As part of the celebration day on May 21st from 4 to 5 Central, EMS will offer a webinar titled Pediatric Pre-Hospital Seizures, Evidence-Based Practice and Future Directions. This webinar will feature presentations from Dr. Manish Shah and Dr. Joseph Finney. There will be education hour available for those who attend the live session. You can register via the link. Objectives are to examine the evidence base and identify gaps in the pre-hospital diagnosis and treatment, review prior work and existing resources on pediatric pre-hospital seizure management, and understand the future of research and care. Oh, no. Okay, any questions?
Thank you.
Thanks.
Next is Indiana Fire Chiefs Association EMS Division, Jared Sykes.
Good morning. I just want to pass along some updated changes with the Indiana Emergency Response Conference this year. We're going to be rebranding the conference into the Indiana Fire and Emergency Leadership Conference with the theme of building the culture. That'll be September 17th to the 19th up at the Embassy Suites there in Noblesville, where we had it last year, and we look forward for everybody to attend.
Thank you very much. Any questions for Chief Science? Hearing none. Indiana Emergency Medical Services Association?
Good morning. Thank you for this opportunity to share. We've got several events that are coming up for IMSA. The soonest ones are going to be next Saturday. Saturday morning, we have the annual Run with Shears event that is coming up. That is a 5K that takes place at White River State Park. All the proceeds for that go to the EMS Memorial Fund. It's a great course, 3.1 miles, fairly flat, somewhat shaded, pet friendly, stroller friendly, fully paved, all that. So if you'd like to be a part of that, we are continuing to take registrations through the start of the event, which is going to be 9 a.m. on Saturday. You can register at Run with Shears. If you just Google that, you'll see that pop up, or you can do it through our website, either one. It's $39 per person. That's for the walk or the run. We also have a kids fun run that we're doing. It's $5. Everybody who participates gets a medal, kids and adults, and then all the adults also get a t-shirt. This is an official event through Racemaker. So if you are the kind of person who tracks that and is trying to get qualified for certain things, there's the ability to do that as well. This year, we're doing a couple additional awards. So we are doing trophies for first, second, and third place for walkers and runners. We also have a large cup-style team trophy that we're doing for whichever team brings in the most participants. So it's going to be fun. That is being sponsored by several organizations. IU Health is sponsoring that as our award sponsor. We also have Eskenazi, who is our course sponsor, and then several other operations that are helping us with that as well. So thank you to those individuals as well. If you can't make, or if you can, the race, we do also have our Golden Siren banquet that evening. That's going to be at 6 p.m. at Primo's on the south side of Indianapolis. If you're not familiar with Golden Siren, this is IMSA's kind of Hall of Fame. So what we do is we get together, we honor multiple providers, so EMTs, paramedics, dispatchers, leaders, those types of folks who are involved in EMS. And then we conclude the evening with the inductees to our Golden Siren group. Golden Sirens are people who have been in EMS for at least 25 years and who have made a significant contribution to EMS in the state of Indiana. This year is going to be a little bit special in that we will also have all of our previous IMSA residents that will be there. So it's going to be a great opportunity to kind of see the history of IMSA, get to know some of the people, even from the very beginning, who started the IMSA organization, and kind of get some perspective from them, where we started and where we are today. If you are interested in that, you can purchase tickets for that on our website as well. Those are $40 per individual. There is dinner, there's drinks, there's all kinds of stuff that's going on as well prior to. So come be a part of the early festivities, and then also for the event itself. There will be a photographer there that will be doing pictures and those types of things as well. So again, we encourage you to come and be a part of that. And again, all of that is just there to honor the leaders of EMS. We also have another event that's coming up September 6th. This is going to be a new event for us. This is a poker run that we are putting together. The proceeds go towards the EMS Memorial as well. And that's going to take place in Vincennes, Indiana. Becky Blagrave has been heading that up. She's got a great course set out for everybody. If you're not familiar with poker runs, basically you start at one place, you travel through the area to different stops where you get a card. And then at the end, we see who has the best hand, and then you win based upon that. So there are prizes that are going to be available. We're also doing a 50-50 drawing. There's lots of stuff going on during that event. So more information can be found on our website. Again, that's September 6th. We also currently have our White Rose Project that is going on. White Rose Project is, again, to raise awareness and funds for the EMS Memorial. If you haven't caught on to the theme. That's kind of our big push this year, is to really get information and funding for the EMS memorial. The White Rose Project, what that is every month, people can donate. It's a $10 donation. And for that $10, it obviously goes to help the memorial. But we also use that to purchase real white roses. And then each month we take those to the state capitol and we place those roses that everybody has purchased in the place where the EMS memorial should be standing. For those who don't know, and again, not to offend my police or fire cohorts, but EMS is the only public service that is not recognized for in line of duty deaths in the state of Indiana. There's a memorial for police, there's a memorial for fire, but there is nothing for EMS. We have had 2 deaths this year alone, and Becky can correct me if I'm wrong, but was it 54 total since we started tracking this? I'm sorry, I put her on the spot.
It's more 35 to 40,
Okay.
something like that.
Okay, we'd have to get an official number, and those are just the ones that are reported. We've realized that there's been some that have gone unreported, and then there's some that are also, because they are EMS and fire, kind of get lost in the shuffle of where they get honored. So what we're trying to do is to just bring awareness to the fact that those who have given their lives in service to their community, no matter what their service capacity is, we need to recognize and remember them as well. So the White Rose Project does that. And again, we've placed those white roses there as a reminder to our legislators and then also to the rest of the community that people are out there and they are giving their lives in service to their communities. The other things that we have going on is the Crossroads Conference. So this is the conference we do every year. This is going to take place in French Lick, Indiana again this year. It's going to be on November 27th and 28th. This is a partnership with the Emergency Nursing Association. We've been doing that for the last 3 years. And as a result, we are offering tons and tons of education for both EMS and nursing. This year, actually last year and this year, we're going to do an MIH track as well. So there'll be clinical for nursing, there'll be clinical for EMS, there'll be an MIH track that people can get involved in, so community paramedicine and all of that. We also have leadership and management tracks. We cover topics, everything from, again, clinical education, disaster preparedness, lots of good information. All of them are CAS accredited, so that you can get all of your credit hours and all of that. They all count towards that. The ENA makes sure that all of that is taken care of.
I think you may have your dates. So I have the 20th, like 19th, 20th, 21st. Robin said the website, I think, has the week of Thanksgiving the next week.
Okay, then that is incorrect. So it's the week before
There
Thanksgiving.
we go.
Sorry, thank you for that.
No problem.
I think their slide last time has it correct up there, 19th to 21st.
Yes,
There you
and
go.
so the 19th, sorry for that date error there. So the 19th will be the commission meeting and the IMSA meeting, but it's also pre-conference. So we do have a day of pre-conference. It's my understanding we're doing a hand tending instructors class that day. There'll be, I believe, a moulage class. We're doing several other education tracks. We're doing a track on billing and also documentation that day as well. Lunch is provided in the costs for that. So if you guys are interested in being part of the pre-con, and then for the conference itself, it is 2 days of conference, starts early in the morning. We do have a great keynote speaker this year that's going to be talking a little bit about kind of their experiences, and that it kind of combines nursing and EMS. So we're looking forward to that. Again, lots of opportunities, lots of tracks. We also have our mixer that's going to be going on again. That I believe is going to be a 20s theme, if I'm not mistaken. So it's going to be a fun time. So we encourage everybody to come out, get your education, have a fun time. If you've not been to French Lick, to the French Lick Springs Hotel, there's lots to do there, including the casino, if that's what you're into. But there's lots of opportunities for fun stuff to happen there. We are currently taking abstracts. So if you'd be interested in presenting there, we welcome your information. It doesn't matter what your topic is. If you feel like it's important and people need to know it, we encourage you to submit it. The way we track or choose those is through a blind submission. So we don't know who did them. We just look them over. We see who did what or what's presented. We kind of pick what we think is going to fit best with our theme, and then we let you know. So again, please submit those. No matter what the topic is, again, we cover all kinds of stuff, everything from clinical to leadership. You may just want to present on research that you've done or want to present or you think something might be beneficial. So please do that. And then we also have our Governor's Cup that's going to be done during that time as well. The Governor's Cup is a competition that we brought back a couple of years ago. That is an EMS. You can do either BLS, which would be 2 EMTs, or you can do ALS, which would be an EMT and a paramedic. And we basically do scenarios, kind of just like they do with gyms and that kind of stuff. In fact, our ALS group that won last year participated in this year's gym games at FEIC. So again, there are opportunities for that. All you have to do is sign up. There will be an opportunity for you. Let me rephrase that. So when you sign up, we do regional events for the Governor's Cup, and then we take the winner from each region. They compete at the conference for first, second, third, and so on and so forth. So if you'd like more information on that, please let us know. We'll be happy to get you that information. We do have a new website. So if you're used to going to our old website, which was indianaems.net, that is no longer functioning. I think it has a link that will take you to our new website. That is indianaemsassociation.org. We decided to update a lot of our social media and those types of things. So we've gotten away from our old site. This one is much better, much more user-friendly. So again, that's indianaemsassociation.org. And then the last thing that I will share is today, we have a meeting following this at 1 p.m. If you are a member of IMSA, we encourage you to be a part of that. We do have elections today. There are several positions that are open for election or up for election. Some of them are contested, some of them are not, but if you'd like to have a say, and again, you are a member of IMSA, we encourage you to do that. And if you're not a member of IMSA, please, please, please get involved. It's a very small amount of money to support EMS across the state. There are some benefits to you as a member, including discounts at conferences and those types of things. So again, if you'd like more information, I'll be around throughout the rest of this meeting and this afternoon. Feel free to ask me. I'll at least be able to point you in the right direction, or check us out at indianaemsassociation.org. Thank you.
Two things that Bob Miller noted in the comments there is critical care as well as one of the items offered there. And then we also are, National Registry has agreed in principle to do a pre-conference for primary instructors. And then we look to probably have sessions attached to that and make it an all day. They have 4 hours of presentation, but it looks very good. So please watch for that. And I think the EMS Association, we are one of the sponsors for the MIH information, but we're excited about the primary instructor edition as well. We think that'll be a good opportunity.
Moving on to Education Oversight Committee. Mr. Chairman, we have a report as well. Moving on to the Mobile Integrated Health Committee. Director Kennedy.
Thank you. The MIH committee met on April 11th. We continue to have subcommittees work. We are meeting on June 6th. Data collection, we have a pilot that is going, and Emily and Corey and our IT have done a lot of work on that. We've had some pilot, and we have a second version of that, and we're opening it up to more people as well. So I applaud them for that. And then after a little bit of a drought in program approvals, we actually have 5 today. And so turn it over to Emily to cover those.
I'm going to try to work this thing. I don't know that I'm going to be able to, so patience, I apologize.
There, Cyrus.
Changed. There you
There you go. Okay. I want to make sure I had it first before I did anything. Or maybe.
There's still lag.
We're going.
Talk very fast.
I don't have any problem talking really fast.
I would just start where I had.
Okay.
Just go ahead and start.
So application process is unchanged. You can still apply online. Our website has not changed any. Application, it does not save. I have had people say, well, I tried to fill out an application online. I've started it, I've gotten busy and I've walked away. It will not save, so I've had to restart. I'm like, it's a smart sheet, so you have to do it all at the same time. You cannot restart, or you can't do it, save it, and walk away. You have to do it all at the same time. So it only takes about 5-10 minutes. If you have it, great. If not, that's okay. You can either restart, or if you need help filling it out, please contact me. We do have 5 applications we're going to go over today. We have North Vernon Fire Department, Salem, Washington Township Fire Department. We have Spencer County Emergency Ambulance Service. We have Stark County Ambulance Service and Warren County EMS. So our first that we're going to review is North Vernon Fire Department. They're in District 9 covering Jennings County. So those are the initiatives that they would like to start out with initially. You see they would like to go over hospital dismissal, post-response follow-up, any kind of diabetic and chronic disease management, decreased EMS utilization, mental illness mitigation, OB and newborn management, and elderly management with falls and those kind of things. So the broad goals of their program, they want to keep repeat patients out of their emergency departments is their main goal, as well as decrease the amount of their EMS encounters. They are a rural county, so there are a limited number of their responders. Right now, they are really not required to do any kind of additional training. They are required to meet all of their departmental training. But as their program develops, then they'll decide if there's any required training at that time. I don't know if we have anybody from North Vernon here, but do we have anybody online that would like to say anything about their program? I will move on then. So next we have Salem, Washington Township Fire Department. They are in District 8 covering Washington County. These are their initiatives. Also hospital dismissal, post-discharge, post-response follow-up, as well as diabetic counseling, decreased utilization of EMS, substance abuse, mental illness, OB and newborn management, elderly management, and immunizations. This is also a rural area, so help is limited in these spaces. We all know that. So they do like to cover a lot of these things. Sorry, I went too far. So their broad goals are to assist their community. They want to provide their health system to really decrease their reoccurring calls that are really putting a strain on their county. They want to educate their public by highlighting specialty care resources that their county provides, as well as as well as what their surrounding counties have to offer. Their MIH providers will all be certified or certified at a minimum of emergency medical responders. There are no additional trainings or education requirements at this time. They will all meet minimum requirements of the department. Do we have anybody for Salem, Washington Township online at this time? Yeah, Max, or anybody? So we'll go ahead and move on to the next department then. I don't want to click too far ahead. Okay, so this is Spencer County Emergency Ambulance Service. They are in District 10, covering Spencer County. Their initiatives are as follows. They are hospital dismissal or post-discharge follow-up. Their decreased utilization of EMS. Substance abuse and mental illness mitigation, elderly management, and immunization, most of which they're already doing in certain aspects. Also a very rural county. This is where Santa Claus, Indiana is and where Holiday World is. So the broad goals are to add community programs to better care for their aging population, as well as continuing their already established community health programs. Their providers will be required to meet all department required training as well, but they don't have any additional training at this time, but they did state that as their program develops, they will be adding additional training. They just don't have any specifics right now. I did see Jane log on. I don't know if she's still there.
Yeah, Jane's
Like
on.
to add anything else?
Jane, do you have anything? No.
No, I do not.
All right, hit the button, but I didn't want to get impatient. Those. So Stark County Ambulance Service is in District 2. They will be covering Fulton, Marshall, Pulaski, and Stark counties. So their initiatives are as follows. They want to do the hospital dismissal, post-discharge, post-response follow-up, diabetic and chronic disease management, decreased utilization of EMS, substance abuse and mental illness mitigation, newborn and OB management, elderly management, and immunizations. Their program goals are to improve collaboration between their patients and their medical offices and their physicians. They want to identify and intervene on high-risk patients, ultimately improving the patient care as a whole in their community. They also, providers are required to meet all departmental training, and they will also identify additional training as it comes. Anybody online for Stark County or in the room for Stark County would like to know about anything additional?
Yes, this is Jim Garner, Director of Stark County EMS. We're trying to move our county into a much needed program. Our community relationships we have a lot of elderly that are just popping up that want to go to the hospital all the time. If we can get them to a point where they feel comfortable with our program, that is beneficial to everybody. The education that we can provide just for the diabetics and the prenatal care that we can give, try to keep some of them, the lower socioeconomic status, out of the hospital because they can't afford a lot of the copays that are coming out now. We're just looking forward to getting moving with the program. That's all I have.
Thank you, Jim. Okay, so our final program that we're going to review is Warren County EMS. They are in District 4, covering Warren County. So their initiatives are on the screen. They are also hospital dismissal, post-discharge follow-up, post-response follow-up, diabetic and chronic disease management, decreased EMS, substance abuse and mental illness mitigation, newborn and OB management, elderly management, and immunizations. So their goals are to reduce healthcare system costs and reduce patient costs by assisting and monitoring and management of their chronic diseases, of their patients' chronic diseases. They would also like to improve the quality of care and provide better access to healthcare for the underserved population in their county. They would like to pilot their program for about 6 months, and then after it is fully implemented, then they would like to require their providers to obtain their community paramedicine certification through the IDSU. I don't know if we had anybody from Warren County online, but if there is somebody who would like to say anything about their program, they're more than welcome to know. Other than that, that's all I have.
Thank you, Emily. And I think almost all of these were at the MIH committee meeting and presented to us and were available for questions. The committee considered all five. We are recommending approval for North Vernon Fire Department, Salem, Washington Township Fire Department, Spencer County Emergency Service Ambulance, Stark County Ambulance Service, and Warren County EMS as approved MIH providers.
Under other conditions. So moved.
Second.
Motion in the second. Any further discussion? Please call the roll call.
Lee Kirkpatrick,
Aye.
Darren Hoggett,
Aye.
Dr. Clooney, Matt Shady,
Aye.
Alan Dartman has left. We have another meeting. Matt McCullough,
Aye.
Mary Ann Dudley,
I.
Lori Bailey,
Aye.
Jonathan Whitman.
Yes.
Motion passed.
Thank you. Those are approved.
That is all of the MIH report. Thank you.
Okay, moving on to new business. Primary structure for the institution, this recommending and.
Yes, so we do EMS district forums and we do those on even years. And we get out and we're in the communities, we answer questions, things like that. And when we were talking as a staff years ago, we have not had one for over a decade, but we used to have sometimes, every several years, there'd be an instructor update, bring everyone together, make sure everyone's clear. Because let's face it, our applications change, our technology changes, and staff spends a lot of time, re-educating. And so the idea was, can we come up with forums? And thankful to Carrie and her staff, they have looked, and we have a proposal for PI education forum dates. The date may change, and I'll let Terry give a high-level overview. Our essential ask of the EMS Commission is if you want to make this mandatory for primary instructors to attend. And so think about that, and I will let Carrie have any comments she has to add or anything on the dates and stuff.
Are we just doing for now, are we just doing the PI forums?
Yes.
Is that what we're doing? Okay. So yeah, what we did is I put together, we do have one that's still pending, but right now tentatively, we've got for the northern area, I divided it up just like we did the provider forums. July 1st from 9 to noon, that's Central Standard Time, of course, up in Canada, as Corey likes to refer to. That'll be in LaPorte. It's at the same location where the provider forum was. Northeast area will be Friday, July 25th, 9 to noon, Ivy Tech, Fort Wayne. Central area, Franciscan Health Indy on Friday, August 1st from 9 to noon. And then I'll screw it up. There we go. Northwest Central, Friday, August 29th, 9 to noon. Southeast area will be Harrison County Hospital, October 3rd, 9 to noon. Southwest, Friday, October 7th, 9 to noon at Vincent University. Zach Westfall is still getting the route number, but he was sure he could find something somewhere on campus. So we also, in fact, I just went over to see if Michelle was there. We are also trying to do one here at the MAC on Wednesday, July 9th from 6 to 9 p.m. For those of you that need something maybe a little bit later on here at MAID. We're just waiting on them to confirm. Unfortunately, she's not in her office to confirm that the date is available, but that probably will happen as well too. So that, like I said, the only other thing is we were trying to decide whether this should be something that's mandatory or not.
Discussion.
Our proposal is that it be mandatory, and then when we get to a point, if we see how many people did not attend, then we will come up with an alternate plan. We aren't yanking their certs or anything. We want to see if we want to do training or what.
Something like that.
And there's not a virtual option or anything. I mean, somebody.
Not for these, because we want the in-person connection in case we have handouts, but it'll be recorded in case we elect to make that a makeup opportunity.
Okay.
Entertain a motion.
This is done every year. I'm sorry.
Every year.
No, we haven't done one.
Oh, just this year. Then we'll evaluate. I don't know that we would do, that's a good question. So we do the district forms on even years and we have enough content. I don't know that we would repeat this at 2 years. We would just have to see if there's much change. But this year, besides some of the changes, for instance, Gary's going to talk about in a bit, our Jones and Bartlett test prep will have, I think they're going to participate and cover that opportunity and stuff. So I don't anticipate it being.
Plus, we started those PI quarterly meetings too, so, that's a great way that PIs can keep up with things as well too. We've added that over the last year or so. So, yeah, I don't think we need them every year, just if there's a major update.
How many people does this affect approximately? Do you know?
How many people?
The number of people.
Primary instructors, I'd have to look up, but we have several hundred, I want to say about.
11.
I want to say just shy of 800.
Yeah, I would say, I thought it was in the 700s.
Like the tracking burden of that to track this mandatory thing is that with this short of a notice, starting in June or July.
They have their own certs in our system, so it's pretty easy for us to track.
I would make a motion to, for this to be mandatory. With the, with the ability to be flexible to, monitor that, to monitor that.
Was it mandatory last time, Craig? Was it mandatory?
When we used to do them, there were some that were voluntary, but they were mandatory.
I thought they were.
Because it was part of keeping your updates.
So we'll bring back a few years.
Yeah.
I guess the main reason I feel that is because you haven't done one in such a long time that I think making it mandatory.
That's why.
Reasonable, yeah.
Yeah, because we agree a lot can be done virtually or electronically nowadays, but we haven't done it in person because sometimes the questions and stuff really facilitate understanding the changes.
We have a motion, we have a second. Hearing no second?
I thought we had a second, sorry. Did we not? Did we not have a second?
No.
Then I'll second.
There we go. So, any further discussion? Call the roll, please.
Lee Durbin,
Aye.
Darren Hoggett,
Nay.
Lisa Clooney,
Aye.
Matt Shady,
Aye.
Matt McCullough,
Aye.
Mary Ann Dudley,
Aye.
Lori Bailey,
Aye.
Jonathan Witham.
Yes. Motion passes. Thank you. Moving on to old business. Article 4,
Thank you.
certifications, education, board update.
Okay, update from the last time. Good news. We are not going through it all again, at least at this meeting. And thank you. I have had some questions from commissioners and the public, so I know people are looking and I would rather people ask so we can discuss before we approach with a final draft. These were the highlights that we had. I'm not going to go through them since we are not taking any action on this today. Kind of where we are is that we need to get approval of our public safety secretary. And then it would come back to you for consideration of the draft. And in order to do that, we have to do a fiscal analysis, which I believe I have done. And that was one of the questions someone said, is there funding that comes with the rulemaking? There is not. So this would be, if it adds requirements in certain areas, then the providers, whether they be individuals or corporations, organizations would have to comply with it. And so we have completed that fiscal analysis, which is 42 pages long. Took me some length because I really dissected it. That has gone over the legal, but they need time to review it before they meet with the secretary and then report back to the commission. So that is where we're at. We did have one of the questions that was reached out to us though, was on continuing education hours from a rural setting. we have two main requirements for our primary instructors to maintain their certification. There's education hours, which are the 12 hours, and those are in teaching techniques. So they can take an instructor course, instructor updates. So for instance, the one we just approved would count towards that 12 hours. So they're going to get probably 3 hours there of their continuing ed. So that is one thing we have, but we've always had a requirement that we do 80 hours of education in that area. You have to teach EMS. And what we heard from the rural area, that it is sometimes challenging. And I do know that from my Putnam County days, because in a rural county, they might have one EMT class a year and they have 4 instructors. So while the class might be, 120, 150 hours, not one instructor is going to get 150 hours. And so it becomes challenging to get the actual hours. And when you look at the national level, for a NAMC certification, you have to maintain education technique hours, but not any kind of subject matter. The staff reviewed this, and our recommendation is that we actually think we need to keep the 12 hours of adult education techniques. We feel like, and Carrie's done an excellent job with the quarterly updates. And so you get 2 hours for each of them, and it's very easy to get those hours now. And as I said, you can also take an instructor class. If you become a CPR instructor, those hours count towards it. The teaching EMS topics, we are recommending, there is an argument, should the subject matter, should that really be up to the training institution and should they monitor? And I think that's NAMC's position. Our position is we think it is good because we have crossover instructors from fire, law enforcement. We think you do need to teach EMS to make sure you're staying abreast of the changes. We just feel the 80 hours is, and honestly, either number is a little arbitrary, but the 80 hours is a little cumbersome. It's easier in I know there are probably some suburban and urban areas of like, that's a drop in the bucket, it's easy to get. But again, if you get in a more rural area, it is a challenge. Our recommendation is that it drop from 80 hours to 40 hours, which we feel is attainable in a 2-year period. That's what their certification period is. And then we may want to amend for the other certifications. We have a clause that states attend any update sessions as required by the commission, just to clarify that you can add to that. And so those would be the 2 thoughts for consideration. You can discuss it. You don't have to take action today. Both of those are written in rules though. So it's nice to know where we're headed for the rules for the draft. So if you decide to take action today, then I can modify the draft. But if we delay it, we just need to stay on a tight time deadline. So that way we don't delay that rulemaking. Open to any questions or comments?
Can you repeat your second thought? The 40 hours I got.
Yeah. The second one is for any other certification, EMR, EMT, we have provision that says the commission can require updates periodically. What it does is this clarifies in the primary instructor cert that you can require a specific, something came up where like everyone needs to take this 1-hour course, you guys would have the ability to do that.
Discussion, and if we do for a motion, we'll probably need to get fairly detailed. Any discussion? Thoughts?
I do hear of a number of guys that have trouble getting those hours and don't want to give the PA because it's not their primary function anymore. And certainly some of them would keep it if it was a little bit easier to maintain, just because it's not their primary job function any longer.
And for the real world implications for people who don't understand, so I keep mine up and it was a challenge to get 80 even with me public speaking, but I have the ability to go to an EMT class. So if you teach in an EMT class, you have to be a primary instructor. So sometimes I get invited and I go present on, say, documentation. The real big difference is if I let mine lapse, then, you know, if Jen invited me to one of her classes and I taught, she has to be there. If I still maintain my instructor, then if she has a scheduling conflict, and would you mind doing the class, I can go teach it independently. And so I think even though there is a risk that you allow some instructors that are less active, I think they can fill valuable holes in the education process. And that would be up, they still have to be affiliated, so it'd be up to the training institution. Training institution could say you have to teach more than that. You know, this is just the minimum for their certification.
Yeah. So pleasure of the commission, would you like to act on this today, or this is not being like, he did say there is time.
And I think the way I'm viewing it, just to clarify, so we still have a draft of the rules. So what I'd be asking today is, I guess I'll word it, so if someone wants to accept this motion, you're asking me to modify the draft to reduce the hours from 80 to 40 hours for EMS teaching, and then add a requirement to attend any updates as required by the commission. And then, so you'll still have to approve it as part of the draft if it comes back then.
So moved.
Seconded. Any further discussion?
If there's a requirement to attend continuing or to attend updates, is there a cap on that?
There is not. Usually when we require them, a lot of times if it is an update, we'll usually do a non-rural policy, so it's clear, so it becomes a little more. To be honest, on the other ones, we have only added, we added two. We added the driver safety one recently with the NHTSA program, and now I'm drawing a blank on the other one. So we added two, but we ended up putting those in the rules.
Mental health.
Oh, no, thank you. That was part of statutory change, so it is in there. And so, yeah, we don't do them frequently, but we like to have that opportunity, because the other option, if you don't have it, is then you really have to change the rule. You know, you have to adopt a rule, says you have to attend a specific section. And sometimes on these one-offs, it is easier just to have a requirement versus adding a line item rule.
Could we limit it to updates that are required by statute? So that it doesn't get stuck in the rulemaking process that's an unfunded mandate that could be. Because if all of a sudden the commission says, you've got to go through 40 updates next year, and we don't have money to send you through all those updates, you got to do it on your own, that may slow down the rulemaking process or completely stall it.
I think you could. I don't know the other provisions have it. So it's in, so it would make it in line with VMR, EMT, advanced and paramedic, because we would use that language. They currently have that.
I'm thinking also on that is if you had something, you know, just COVID, for example. Let's say we had something occur that required some immediate training, and we would have to have it, always covered in our emergency.
Sort of mandated through that, that's what you're saying.
So that your provision wouldn't prevent something like that.
So you're saying my provision to limit it to statutory updates, but then if there's something outside the statutory update, we use the urgency or to do that.
That was all I was thinking of some of the night crop up there. So we have a motion on the table with a second. Any further discussion? Want to put the, amend that for the statutory?
So amended.
Motion's been amended, second has been amended, okay. Any further discussion? All.
Steve Turbin,
Aye.
Darren Hoggett,
Aye.
Dr. Clooney. Aye. Matt Shady,
Aye.
Matthew McCullough,
Aye.
Mary Ann Dudley,
Aye.
Lori Mailey,
Aye.
Jonathan Witham.
Yes.
Gotcha. Anything else on the old business?
No, so we will continue to update. I will do that change in the draft and then, hopefully we'll have an update in July where we are on the approval.
Moving on to administrative proceedings.
In my notes. So on administrative proceedings, you don't have any action today. You see the waiver orders there listed, fairly standard. You do have several sanctions that were issued in there. And then, the rulemaking we went over. On the appeals docket, we still have Matthew Copeland pending. And we have a case and appeal now, and I've lumped them together as Keener Township respondents. We have 4 individuals and then we have their appeals pending. And then Troy Loudon is pending. The ALJ has issued a non-final order on that, which would dismiss it because he hasn't been completed. However, he has so many days to appeal to that order before it comes here for a final determination. So if he does not respond, then you would see that as a final order consideration for the July meeting.
Any questions regarding administrative proceedings? Hearing none, move on to staff reports. Data registry.
Oh, thank goodness the presentation's back. I don't have my slides. Data registry, we are up for NIPERS reports from last time we met. I've had the field staff going around looking. Still got some cleaning up to do on who's active, who's not active with all the territories that have formed. We've still got people on the list that aren't by themselves anymore, so we're still cleaning that up. But we are moving forward for NIPERS reporting, or moving up. EMS reporting, definitely went up from the last time. Again, cleaning up the list, dropping the people that are no longer, adding the new ones in. So we hit 94% last month for NIPER or for EMS reporting. And then still the transition for NIPERS to nearest. I thought that was backwards. In December, so we'll keep moving forward with that. I'm still learning a lot to try to understand all of that. So I'll be up in Michigan next week with NISMSO, so I'm hoping to hear from all of the other data manager people up there on what they're doing so that I can learn more. That's all for data, unless there's questions. Operations. Still moving forward with the CADIS. We're getting lots of people in there. I hope everybody's finding that easier to use. The people that have done it, I'm hoping the field staff find it easier as they move forward with it. It's been a little bit of a struggle, so we're getting there. Upcoming events, district managers will be participating in the state level exercise, Awakening of the Wabash. My guess is there's probably some EMS people around, or if you're participating within your county, we'll probably hear from you in a little bit. And then there are 3 of us also participating this year in the Indianapolis Airport exercise in June as well. So those just happen to be falling on the same day. So staff will be very busy between those 2 exercises. And then I'm sure Craig will talk about EMS week, but I just wanted to say thank you to all of EMS for what you guys do. And district managers will be out and about. If you want us to stop by and say hello, please invite us. And that's all I got, unless there's questions.
Questions for Rob? Hearing none, we'll move on to certification.
Oh, it's not working, sorry, since your loaner computer crashed, you're out of.
So we were down the first quarter for EMRs by 59 from quarter 4 to 24. And then down 2 EMTs, but we were up 24 advanced EMTs and up 106 paramedics and up 10 PIs. Audits for renewal were up as well. Our total clinicians continue to rise. We're at 79 from the end of 24. Actually,
So it's up 25,000 too still.
yeah, I actually just ran the numbers again. Of course, this can change. We were up an additional 1,310, so we're over 26,000 today. 236 audits, in the first quarter. 12 of the audits were incomplete with no response, which is about 6% of those audits. 6 certification dishonesty sanctions were issued. 94 individuals indicated they had a criminal record. 6 of them indicated to us that they were arrested, and that's mostly the first quarter. 68 were cleared, 9 have, we've requested further information, and 7 are still in the court system. Turnaround time for certs and licenses is still 24 hours or less. Depends on how the information comes in. If everything comes in done quicker. The one thing that holds up certification issuance is the violation statements. They should be completed whenever they are starting their course. So they have time to get it done. Any applications that would be sent in by email are now web forms. So you don't have to worry about if the email got to us or if it got to us in the mail. You can do it through Acatus and you'll know that it's submitted right then. It's easier for us to go in and check those as well. And then if we have to email out responses from there.
Question? Moving on. to Education training here.
Go to the first slide. If you like. All right, so finally, the Jones and Bartlett test prep packages have been approved and are pretty much ready to roll out. So Zach Westfall, my counterpart, and I went via virtually with Joy Navi from JV Learning. And I got a little more additional information from her. And so we're going to give you kind of the 30,000 foot overview of how this is going to be launched. We're still kind of working on some of the particulars, how we're going to track it, what's going to be the easiest way, but this is kind of what we have to start off with. So there are currently, this is going to be, we're going to start off with the EMT. We're going to see EMT level. We're going to see if we can later on add the AEMT and the paramedic level to this package, depending on available funding. But currently there will be, for the EMT, there will be 2 test prep packages that are going to be available. Now, you can, the student and the instructor, they can use both of these together or just one or none. So it is going to be the Indiana instructor-driven test prep bundle and then the student-driven test prep bundle. And so I think what we're going to do is JV Learning is going to be issuing the codes to us in batches. And then from there, we are trying to figure out, I think we're going to use the smart sheet where students can then request to have that student-driven test prep bundle based upon the course number. We are going to start this. We picked beginning of July. Any classes starting at the beginning of July would be eligible for this. Reason being is because we want the students to be able to use this throughout the entire course and not started towards the middle or towards the end, because we're going to gather data on how hopefully this will show that it improves test passing of the NREMT. So for statistical purposes, we also chose July as well too. The codes are good for, I think they're good for year and a half, 2 year, they're good for a long length of time. So the students will have plenty of time to be able to, use it. As far as the instructor-driven one, if the instructors are a little confused as to, well, what exactly is this gonna be? Well, don't fret, because we are going to, be hosting pretty soon here. We'll roll out some virtual meetings with, JV Learning staff, and they will give us, they're gonna do like a quick little class as to what exactly is going to be offered in both of these bundles, and what your participation level as an instructor will be for the instructor-driven test prep bundle. And, because it does involve, what'll happen is Zach and I will email the code, for the instructor level driven test prep bundle to the instructor. And then at the same time, we're gonna email CCJV Learning on that, because then that way JV Learning can get the course number from the instructor, and they can go ahead and do what they need on their end. So I know it's a little confusing, but we are gonna have some virtual seminars that are gonna explain to you the advantages of both or one or the other. Some instructors may not have the time to do the instructor-driven one. So at the very least, the student-driven one will be great. But we don't want to just randomly hand out codes for every student, because honestly, we know some students aren't going to use it. So that's why we're going to have the students get a hold of us in order to arrange to have that. Let's see, any questions about that? Like I said, it probably, end of this month, at the very least, at the beginning of June, we're gonna host, several of these, updates. And then also we'll record it, and then that way, if an instructor has any questions and they weren't able to see the course, we can, direct that to them in ACADAS, or JV Learning can set something up privately with them. Questions? Yeah.
Will the content be online or on app?
So that is a great question. I'm not sure if it's available via app and online. I'm not 100% sure, so I don't want to guess and tell you yes, but definitely online, but not sure about the app part. That would be great. Good question. If I talk to Joy between now and then again, I will find out for you. Any other questions? Anything online, Stan? Okay. So again, we have the, education, PI education, forum dates. Again, I won't belittle you with going through them again, but we do have them listed. We will send those out in both the next, newsletter we have, and then also I'm sure we'll do a mass, blast out to the, PIs as well too.
Terry, I had Emily, she put it on a form too, so.
Oh, yeah, I just, right from the place. So if you didn't grab one, there are forms that lists the times and some other information that I've covered today too. So, and don't forget, we're still waiting on that one here at MADE on Wednesday, July 9th from 6 to 9 p.m. So we will get that out as soon as that gets approved. And just so you're familiar, we did talk about last commission meeting, the next PI quarterly updates for the remaining of the year. So the next one coming up will be in June 18th from 9 to 10:30 a.m. Eastern Standard Time. And then repeated the next day, Thursday, June 19th from 5 to 6:30 p.m. And you are welcome to attend both classes if you like, because there are sometimes some things that people bring up, so it can be a little bit different. So I think that's my last slide, isn't it? Yeah. Any other questions about anything education related? Thanks so much.
Okay, state administrative report, if we can.
Well, as I have up there, it's 500 month, and as Jonathan referenced, so busy month here in May, a lot of events going on. We're going to cover some of the highlights. One of the things I want to start with is that, we talk about well-being and we've added training and things. And I do think it's important to be supportive and understanding of people with the challenges of EMS. And one of the shout outs that I wanted to give is for one of our staff members who's been vocal. Stan Frank has been sharing with people about his health challenge with lung cancer. And we applaud him. He's here today. He's been a vocal advocate on fatigue and other wellness things. And so now we just want to show our public support for Stan as he works through this challenge. We do have the EMS division newsletter. The first one is pictured here. We did this issue May. This went out a couple of days ago as well. And it has lots of updates. So if you are not getting that, please let us know. You should get it if you have whole day certification, but you can request and we'll make sure you get on there. Corey is our point person there. So if you have any suggestions for things you'd like to see in there, let us know and we will make sure to get that added. We do try to have calendar events like the quarterly updates, things like that that are in there as well. One of the big things we're excited about, EMS Hospital Summit's coming up at the end of the month out here at May 29th. It is a closed meeting. We elected for the first year. We weren't sure what kind of attendance we would have. And we were afraid of being overwhelmed compared to the planning we had. So we did by invitation only and picked people from different districts. And it is co-sponsored. We're the lead sponsor at Department of Health, Indiana Rural Health Association, and Indiana Hospital Association. And so we're going to talk about things like diversions, interfacility transport, the charting issues, regional medical concepts. And so all of those will be discussed. We'll report back. This was one of the recommendations out of Indiana EMS 2025, and we're certainly looking forward to it. If you are an EMS individual that was invited and have not RSVP'd, please do so, or let us know if you intend to do so, because if you cannot, then we will need to get an alternate for you. Health First readiness updates. The big thing is, unfortunately, again, MIH not funded for the new fiscal year, but the readiness was. And so we will end up with 4.1 million the next 2 years. Here's how we've spent it thus far, kind of the broad categories. You can see grants were the biggest thing, but training and education right behind it. And so we look forward to the future years and what we can do with that. As Carrie indicated, Jones and Bartlett contract is finalized. So we are prepared to go forward with that and begin that project in July. We also are working of interest view. There is a consulting group called Delineate, and IDHS works with them. And one of the things that we are doing is having them take a look at our EMS readiness funding and come up with some data and KPI and things that we can report back to the commission to make sure that the money is reaching who we want it to meet and meeting our end goals. We are finalizing with the National Registry as well. That would allow us to cover the first 2 exam attempts for all individuals, EMT, advanced, and paramedic for their certification testing. So attempt 1 will be covered and then we'll have to 1 retest. And so we heard that it's costly. All right, we know it's costly. It's usually $100 or more. And a lot of people do find money for the first attempt, but sometimes they're borderline on performance. And for the second attempt, they are not willing to spend the money. And we feel like it's an investment. If they successfully pass a course, we're going to invest in them to cover the first 2 attempts. And so that'll be paid for out of EMS readiness. Partner updates, National Registries, we did have a board meeting in April. Nothing, I apologize, we actually did not have a board meeting. We had committee week only. So it's only committees, so no initiatives to report back. We are just progressing forward on some changes and outlooks where the registry is headed. EMS Compact, we just had an exec committee meeting yesterday. We are still working with the CADIS to integrate our data into that. There is a new position paper on safeguarding EMS clinical clinician data, which will be the people that you certify we certify the people that you hire. And what should you release when people want to know, can I get emails? Can I get a phone number? What about a home address? Because clinicians are public safety and it is a threat to individuals. So if that is an area that you're looking for guidance, I would encourage you to consider that on the Compact website. Arkansas has joined the Compact. We're up to 25 states. So we have half the states that are members. North Carolina looks likely to join as well as Massachusetts, or at least they have legislation introduced. And so we'll keep everyone posted on that. NASIMSO, we have a meeting coming up next week. And so Dr. Yezel, myself, and Robin will be heading up to Grand Rapids. And that is Monday through Friday next week. And it looks like they have some good discussion groups on topics that apply to Indiana. So we will be certain to get back to you. On a personal note, I thought I'd share, as I cited, there's a new book, Leadership in Action. Donnie Woodyard, for a lot of you may know, he has Indiana connections. He was with Westfield Fire for a few years and Noblesville with the hospital. And so he is the Compact's executive director. And he has written a couple of books, and he invited me to participate in Leadership in Action, which is short narratives from a bunch of EMS leaders. And so I was happy to contribute to that. But it is an interesting, I've read not all of it, I've read most of the other essays in there, and it is interesting stuff. For EMS week, the agency, our public affairs section has planned a lot. And so this year's theme, we care. And so we will be participating with that, and to that extent, there is a governor's proclamation for EMS week, so we'll be sharing that news. And then we also will have our website set up. I have the address up there, but it'll have the usual EMS week. It'll have testimonials and other information. New this year, watch for on social media. Some of you may have participated. The district managers collected videos, why I love EMS, and we will be releasing some compilation videos through our public affairs. So we're very excited for that. And then we will have a message from Secretary Green and myself for EMS week as well. EMS World Expo, as a reminder, will be here this fall, October 20th to 24th. So right here in our backyard. Early registration is continuing. The earliest, I think, may have ended yesterday or today. But if you do plan to attend, if you register earlier, you can save a lot of money. That will be at the convention center. That completes my updates, unless there's any questions.
Questions for Director Kenny? Hearing none. EMS State Medical Director's report, Dr. Yezel.
Thanks, everybody. Yeah, again, kind of a redundant report. We've touched some of these items, but instead of interjecting on all of them, I did condense some of my thoughts. Back to the Department of Education collaboration on the AED thing. We really are encouraging them to collaborate with their local EMS systems. Number one, obviously, that's an area that needs to be prioritized for various reasons. But also some of our programs, our schools have developed student emergency response teams that are ways to develop our workforce and improve these collaborations. And so we do have a meeting with Department of Education to kind of foster that as well. So hopefully we'll, again, keep developing our workforce, because Corey gave us some good news. We're continue to see it grow. From the MIH side of things, I do think it's important to note, a lot of credit goes to Emily. She mentioned this, and our district managers. I think all 5 of those programs are from counties that either have no hospital or critical access hospitals. And so using MIH to bridge those gaps it's a big deal. And they did a great job to kind of cultivate some of those relationships and support them. But, that's how we're going to bridge some of those gaps in maternal health and substance use disorder and things like that. So I do think that's a big deal. I do think sometimes when we review those, it does give folks pause when they say like no specific training. But a lot of MIH programs kind of take on a life of their own as they move forward and develop a more narrow focus as they see what they're serving. And so a lot of them are going back and adjusting their training, after the fact. So it doesn't necessarily mean like we're not going to do anything. It's we're gonna wait to see. And I think they're also waiting to see if there's some level of standardization. They don't want to send everybody through a course and find out later that they could have got reimbursed for their visit if they did a different course. So I do think some of that is, and I've had a few questions over the last few months about that. So just wanted to make sure we got that out there. I think a lot of them do plan to do training and excellent training. It's just waiting to tailor that to their needs. CARES registry, we've got some questions on that. That is the cardiac arrest registry that our different services can get data. We were working on a kind of an update for that for our different programs and kind of, I guess, pigeonhole it to where you're at with that situation. I'm currently using the CARES registry. These are the things I need to know. I'm familiar with it. I'm interested. These are the things I need to know. And what's the CARES registry? That's what I need to know there. So we'll provide an update for that in the next week or two. I've been working with IDOH on that. We have a couple more places doing pre-hospital ground-based blood products. So we're up to 6 and a lot more interest from several others. So I'd say we have another 10 or 12 that are somewhere at least on that pathway. We put together a toolkit so that everybody's not reinventing the wheel, but there also is a kind of regional blood coalition with EMS services that's starting. We've had our first meeting about a week ago, and I think there's another one coming up in a week. So if you're interested, reach out to me because we'd love to do, if you're looking to do that, there's no sense starting from scratch. There are some frameworks in place that'll decrease that knowledge translation and facilitate your process there. Just to double down a little bit on what Vince had to say about the T-RACs. Those are really, really EMS oriented as we look at our trauma system. And I do think we're probably a little bit underrepresented on those meetings. I don't think we're seeing a huge amount of EMS turnout at those. And I think our input's really important, especially when you talk about now tying that into some funding mechanisms. We want to make sure that our voices are heard and that funding's going out to what's most useful to our cause and things there. So we'd really love to see some of our services get out to those meetings. They're very informative, good, well done meetings. Kind of along the trauma line, the other thing that's come up a lot lately is I've heard from a lot of our tactical EMS operators. We have a lot of different services that have some of their providers assisting our local SWAT teams. And they all do their own kind of training, but it's, at least my impression, is very silent still. The different teams don't talk with each other about regulations, trainings, just idea sharing and things like that. So I just had a discussion on the way up here about that. So I think you'll see at least an informational meeting and see where it goes from there. So I'll make sure to communicate that. Along the legislative update, public health funding, I know isn't directly for EMS, but there's a lot of partnerships there. And we did take some lumps in the recent session. Some of the funding was down about 60%, the Governor's Public Health Commission funding, some of the property tax issues, some of the grant freezing. It's a tight time for public health. And so for some of our services that have those partnerships, never been a better time to kind of show your worth and show how your return on investment is helping the public health system and things like that, because I'd sure hate to see some of those great partnerships decline. So get to the end here, but state in service still getting a lot of great turnouts there. We were pushing 100 people this last month. And always want to make sure that's the best use of an hour for our folks that decide to spend it with us. So always open to topics. Anybody who wants to present would love to have you, or any other ways we can make that hour better for everybody. And then from EMS, we've got a lot of invites to events, and keep those coming. We'd love to get out there, see as many people as possible. From Thursday to Monday, I will be out at the Indy 500 the entire time. My wardrobe choices might be questionable, but I'd still love to see you. If anybody's out on the track, please look me up and stop by. I'd love to see you. So, that's all I got.
Any questions for Dr. Gittison? Hearing none. I will keep my chairman's report fairly short here. CARES reports showed up in email, I believe, on Wednesday morning. And it's very refreshing to see in those that being the CARES participant for a long time. It's very refreshing to see a column with Indiana in there now. So not only can we compare your provider against the nation, you know, but compare against the other providers in the state and the CARES registry as well. So that was a really nice addition. Please remember the traffic safety management course that Craig mentioned earlier in his report, that is something that the commission did mandate. What was the date for completion on that?
And we still have a couple of years for most of it, and Robin has done a lot of excellent work, working with, NDOT. We have a connection through there. So we are in the pilot stage right now, so we have not released it, but we're on track. It looks, I've done part of it. It looks very good.
Definitely one sets of favor. The next, large evidence-based medicine conference coming up is the U.S. Consortium of Metropolitan Medical Directors, also known as the Eagles, coming up the second week of June in Hollywood, Florida. For even field level people that have an intense interest in evidence-based medicine, especially with breaking data, this is a very affordable conference to go to. The cost of the conference itself is, for 2 days, in the just slightly over $200 range. They get a very special rate at the conference hotel in Hollywood, Florida. And it is literally 10 to 15-minute presentations from 8 in the morning until 5 to 6 o'clock at night. So a lot of good data being presented. It's typically, you get to see the beginnings of the studies that you'll see in the next year presented at National Association of EMS Physicians. So it's a great place to get a shot in the arm of what's coming from the science perspective in EMS. With that being said, that concludes my report. The next meeting is Friday, July 18th, here in May in Plainfield. And with that being said, the end of the agenda, I will take a motion to adjourn. So moved.